You're listening to the Yoga Medicine Podcast. I'm your host, Rachel Land. This podcast brings you information and resources to enhance the therapeutic effects of your practice based on a deeper understanding of anatomy, physiology, and the integration of modern science and research with traditional practices and experiences. Join me and my co-hosts Tiffany Cruikshank and Katya Bach as we dive into all things yoga, research, and wellness.
The content of this podcast is not medical advice and is not meant to replace medical care. Please consult your healthcare provider to determine what is best for your unique healthcare needs.
Hello, Marnie. Welcome to the Yoga Medicine Podcast. I'm really excited to talk to you today about all things pain.
Yes, thank you so much, Rachel, for having me, and for Tiffany for reaching out. And I'm really excited to be here with everybody today.
It's going to be awesome. There are so many. I've just finished rereading your book, Pain Science, Yoga Life, Bridging Neuroscience and Yoga. And I got so much more out of it just the second time through because, I'm a different person now than who I was when I read it. And I've had a different set of experiences. So I'm really looking forward to diving in, helping people understand pain and giving them some tips to working with it in a more caring and compassionate way, perhaps. So I was hoping we could start by talking about your professional background. You have a doctorate of physical therapy and you're a certified strength and conditioning coach, as well as being a yoga teacher. So initially, I'm curious, what came first? Were you a yoga practitioner who moved into physical therapy, or was it the other way around?
It was the other way around. I was a competitive gymnast as a youngster, and like athletics and coaching was always part of my life, and that's really what put me into the physical therapy world. And then it's funny, I live in a really small town in Haines, Alaska, and we had lost our yoga teacher. And so part of the group that was practicing came to me as the PT, another exercise teacher in town, and said, "Would you want to teach some yoga?" And I was like, "Well, I practice a little, but I can't teach." And I said, "I can teach you asanas without really, bringing in the full balanced practice." And at the same time, I was diving deeper and deeper into the study of pain. Mm. And it was really fascinating to me, the timing of those two things, how they just kind of married together. The more I was, self-educating myself on yoga and the practice of yoga as a teacher, not even as a personal practitioner. And then the same thing of like diving into this pain science, and recognizing like, wow, everything that they're telling us is kind of in that container of yoga, which is, that we need to be more holistic. We need to look at all of the parts. And really what rang true to me in that was that we needed to learn how to really study ourselves.
Mm. It is.
And so that, go ahead.
Oh, it's just going to say it's like synchronicity, isn't it? When you're really receptive for the lessons seem to appear, don't they?
Exactly. Mm. Yeah, exactly. And so then I actually ended up saying, like, I want to go to yoga teacher training, mostly so that I can see if I could find a way to bridge these two that I kind of feel like innately is happening. Mm. And also I felt like, 6-7 months into teaching a class, I couldn't feel genuine, like I could still teach. It was one thing to fill in for a month or two, but it continued, and I was like, well, I need to become a teacher. And and then that's what made me find Tiffany, and she just spoke so much to all of those little bits. She's athletic and she pushes, and that's what I wanted kind of more as for a personal practice. And then she's got the holistic medicine side, from her acupuncture. And that's what landed me with Tiffany initially, and then she bridged into yoga medicine, and it's kind of again very synchronous, joining of the all these entities together.
Yeah, I think we've all experienced pain probably multiple times in our lives. And sometimes it's really straightforward. We got some new kitchen knives. I cut my finger the other day. It hurt, but gradually it has hurt less as it's been healing, and now it's healed and it's right back to how it was before. But I've also had experiences of pain that are much less straightforward, that are much less linear, and healing seems to occur in kind of swings and roundabouts. So maybe next it would be helpful to set some context for our conversation by having you explain what pain is, and perhaps to kind of break down some of the misconceptions that we might have about pain being a straightforward signal of damage, for example, from our tissues to the pain centers in the brain.
Yeah, pain is a fascinating experience in our body. And I really like that idea of an experience, because when we think just in general, like what is an experience, it's really hard to say, well, it's one thing, right? It's all the things. We go to a concert and we experience a concert, and we have the visual musicians on the stage. We have the music that we're hearing in our ears. We have individuals around us. We have the temperature of the room. Like that's the experience, right? It's very different than just listening to a song. And I think pain is similar to that. We have an input from our periphery, and in the neuroscience world, that input is termed as nociception, which is really kind of synonymous with danger or threat message. So when you cut yourself with that kitchen knife, there was a mechanical sensation or stimulus that hit the mechanoreceptors. And along with that, because there was enough of an insult or threat from the mechanical change to the tissue, along with that goes something that's called nociception. And there's a lot of things that happen as that message travels from our periphery, from your finger, up through your spinal cord, and then finally into your brain. But I think the biggest piece is that pain doesn't happen when you cut your finger. Pain happens as an output of your nervous system, and it's multidimensional what comes into that to produce an experience or an output.
And even just that blew my mind when I was first exposed to pain science through your work, that pain isn't an input, it's an output. And that output is based on all of the rich experiences and context that our brain creates to assess what's going on. Mind blowing.
That's right. And, I think initially when I first say that, people are like, what? No, like pain lives in my, pain happens the minute the knife hits my finger. And in that scenario, that feels really true. But we can all think of times when we are, let's say, out in the brush hiking, or like in my world, picking blueberries. And, we come back and we're like all, cut, right? Like we've hit little branches and things have sliced our skin, and we didn't stop to notice those. And that's because they weren't important, right? It wasn't something that our brain and our whole physiology determined to be threatening to us. So we didn't have a need to respond. And I think that's the other big piece about, this idea of pain, is that it's when we feel it, it's there to encourage us to take action. And in an acute setting, that's it. It usually works pretty well. You feel that mechanical stimulus of the knife, slicing through your skin. Your brain takes into consideration everything that's going on. I have a knife in my hand. I see some blood trickling out of my digit. And what's the best thing for me to do? Remove the knife, right? And then we do all the things that we need to do to stop the bleeding. And, maybe you're not going to play the cello that night.
Or any night.
You're going to give your hand a moment to, to kind of recover. And then hopefully things heal. And as they heal, our pain and sensitivity, dampens down because we don't need to protect it anymore. I think the thing that becomes very, interesting to me as a physio and, people who are working with those that are suffering from pain is why is it that pain continues after tissues have healed? And or why is it that pain comes on sometimes when we can't really find a good, tissue reason? So I think that's a big, misconception is that if we're in pain, that means that there's something that's damaged or injured or ill. And the truth is those aren't, don't naturally line up.
Mm.
And especially the longer that pain is present, the less it really gives us much indication of what's happening in the body.
So I think it makes sense for us to really hone in on persistent pain today, because acute pain, as you said, is for most of us pretty straightforward, follows the rules that we thought applied to pain. But I think all of us can think of an example, whether it's in our own experience or someone that we've worked with as a yoga teacher or another movement specialist that has had pain that never gets a really clear diagnosed cause, that doesn't necessarily follow predictable rules of arriving and departing. And so probably a more helpful place to spend our time. But one thing I want to go back to before we really dive into defining persistent pain is talking about pain as an experience, the example that you gave of the concert that we go to. When we go to an experience that we are excited about or we enjoy, we're really looking for all those details. We're drinking in the sights and the sounds and the feelings of people around us. But pain, I think, is the opposite, or at least for me, and I'm sure I'm not alone. Rather than getting interested in the details, my tendency is to block them out or to push them away, to try and escape that much more unpleasant experience. So could you talk, maybe in the context of persistent pain, a little bit more about that tendency to make pain monolithic and to try and get away from it or ignore it or block it out?
Yeah, I mean, I think that is potentially a result of our culture a
Mm,
little bit, that we tend to, it's almost like we're taught that we shouldn't ever be uncomfortable. And if we are uncomfortable, we need to change that, right? We need to get rid of it. And I can't tell you how many people come and are just like, I just want this pain to go away. Like, just make it go away.
mm,
And I think that in itself, when there's true persistent pain there, that kind of sets us into a road of difficulty, because the fact is it's most likely not going to just go away. It didn't just come on very simply, and it's not going to just go away very simply. And so learning to accept and include and acknowledge and truly feel what is all there,
mm,
I think can sometimes be our first place of turning this experience into something that is horrible and terrible and a crisis and a place of suffering, to something that is like, well, this is something that's in my life, and I'm going to include it and accept it for a little bit of time and start to tease out and see, what's here that I have the ability to shift and change, and what's here that I don't at this time.
mm.
That makes sense. So I actually oftentimes will work with, if you're a teacher and you're working with somebody who's in pain and you haven't really had an intense persistent pain experience, it can be helpful to look at small experiences and see how you can more easily identify what else is there. So, like, if we go back to your example of the kitchen knife, if we change the environment that you were in, let's say that you have a crying child in the background, you've just gotten some really bad news at work and you feel super stressed about it. Maybe there's a flashing light in your eyes, right? All of those other inputs are going to make this individual input bigger, more important, harder to handle, right? And in a scenario like that, if you step back and go, wow, why does that hurt so much? Okay, look at what else is happening. I've been fighting a flu. My immune system isn't exactly great right now. We've all been, part of this world that has a higher element of stress to it. Our lives have been changed with the pandemic that's been happening. And, the crying baby, I have to worry about that. And, so I those maybe not the best, clearest example, but I think the idea there is that oftentimes it's important to step back and
Mm,
look at this big picture instead of just looking at this sensory experience of something that feels painful.
mm.
And we can all do that, right? We can all think of a time in our lives when it was like, wow, that really felt like it left a greater impact than it needed to. And why is that? What else was happening there?
Almost like it becomes, I'm imagining that scenario of cutting the finger is, oh, it's just the last straw. Why does everything happen to me? Everything always happens at once. Why is this the last straw that broke the camel's back sort of scenario? And often you do hear stories like that from people who are in recurring or persistent pain. Why is it always me? Why does it always happen to me? Why did it have to happen now? It's the worst possible time. So when it comes to persistent pain, you unpacked it. There are often some other factors that we see in people with persistent pain at the same time. So they might involve their general health or sleep patterns or lifestyle. And stress is a big one. So could you talk a little bit about the relationship between stress and nociception or stress and the pain experience?
Yeah, the best way I can say it is that it's when our stress system is heightened, um, our nociceptive system is primed to be more sensitive. That's
Which
kind of
makes
the
sense
easy.
evolutionarily, doesn't it?
It does, and it makes sense even in the like if we remember that really pain is meant to protect us. If we're already under some sort of other stressors, then we can't tolerate much physical sensation. Like we have to deal with all of this, right? And so they just kind of go they go hand in hand. And I think that's when I like to play around with the like if we can step back for a moment and see what elements of these stressors can we shift. I like to say control, but that's not a great way to say it. But can we shift? Can we alter? And which ones can we not? So initially, like if I can't do anything about the fact that I have this ache in my shoulder, let's set that aside and look at what we can do things about. Can we have that conversation with our partner that we've been putting off, that's been heavy on us? Can we look at our sleep patterns? Can we look at the things that we're doing to shift our immune system? Can we look at how we're thinking about this painful experience, this sensation? Like you said, why me? Why is this happening? I can't handle anything else right now. You know, I'm not going to be the person that I once was. When we have all of those, that we use that word catastrophic thoughts, when we
Mm.
have all of those thoughts and beliefs spinning through our head, we make this experience, grander. And that's one of the places that I feel like sometimes can be an easier place to start is how is it that I am thinking about this experience?
And you
That just
draw in the book, at least from Buddhist philosophy, not
mhm,
just from yoga philosophy, but from Buddhism as well, talking about the second dart, the first dart of something that we can't control that happened to us, but then we tell ourselves a story about it and we make it into something much bigger and these massive consequences and catastrophizing. It's the beginning of the end. And we all, I think, have seen that tendency in ourselves at some point. So using that second dart, taking it out, taking it to one side as a way to kind of get toward the first one. Is that what you're describing here?
yeah, I think in that lesson, the idea is that if you're hit with a first dart, it's gonna sting a little. But if you're hit with a second dart, it's gonna sting even more. And in this mindfulness practice, the idea is that the first dart is the initial insults or injury or even we could even just say input, right? Because it might not be an actual injury. And then it's all the things that we add to it that create those places of struggle and suffering, like I said about the, playing the cello. So I slice my finger a little bit, and if I immediately think like I'm never going to be able to practice again, I'm never going to be able to pick up my child, I'm never going to be able to, all of those thoughts add to this need to protect ourselves, and it will create a greater entry point for the experience of pain to become bigger. And those are, so the second darts are the things that we have the ability to control. We can look at those and say, actually, if I can truly step away, I cut my finger. Everything else isn't totally true, right? There's some elements of truth there, but they're not totally true. Yes, I might not be able to play the cello today, but that doesn't mean that I'm not going to be able to play it in 2 or 3 days.
Mm. And this can be compounded when, as often seems to be the case, people have been told this by somebody that they respect as a professional or as an authority. I think every yoga teacher's had somebody come to them and say, I basically have no rotator cuff, or I'm bone on bone, or, my doctor said, I won't run again. And I mean, I do really respect medical expertise, but bodies are constantly surprising. And the more unexpected scenarios I see, that the less confident I feel that we actually know what's going to happen to people. So maybe we circle back to talk about language toward the end. I think for now, you've brought out a lot of really juicy things already that I'd like to tease into a bit more in the context of persistent pain. That when you're working with persistent pain as a medical professional, you usually do take a multi-pronged approach. It isn't usually just physical therapy or just drug therapy, for example. Usually it requires a range of things to help people experience some improvement in their experience in their body. And so I think already people listening can see, those of us who practice yoga, where yoga might come into the picture, whether it's, I can't help your shoulder, but I can help your feet, or I can't help your shoulder, but we can do some practices that will improve your sleep, or that will improve your ability to manage stress. So let's shift gears a little to talk about where you saw the in for yoga, where you sort of saw those places that yoga would be uniquely helpful for people with persistent pain.
Yeah, I want to touch on one thing that you said there that maybe we've kind of gleaned over a little
Mm,
bit, is that I think it is really important to recognize that, as we said, pain is an output, and it's an output based on multiple inputs. So
mm,
one input is the nociception that we talked about. Other inputs are our thoughts and beliefs. Other potential inputs are our emotional space, right? So all of these dimensions are going to create places where our brain is trying to wrestle with this question of, am I actually under threat or not? And if I'm under threat, then I'm going to experience pain. And if I decide that I'm not under threat, whether it's there or not, I'm not going to experience pain, right? And so if we can think about that it's like in the book, because you've referred to that a few times, we
mm,
developed something that we call a pain mandala. And the reason we chose the mandala is because it's a dynamic entity that doesn't really have a true beginning or a true end. So as pain is persistent, it's harder to say it's because of the knife, right? Or it's because I twisted my ankle, or it's because I did that hand balance and, did something to my rotator cuff.
mm.
When we can actually find the injury to the rotator cuff, where do we go? Right? Like, what do we do? Especially as a yoga teacher who might not have all of the other medical training. Well, what we can go to is say, how is the rest of your being feeling? Right? What else is here? Do you have room for your breath?
Mm.
You know, Do you have room for feeling optimistic? Are you sleeping? How are you holding your body, whether it's this limb that is directly involved in what you're complaining about or something else? And I think that is the bridge that I felt like was that natural place where yoga as a holistic practice is a great fit, because to me, like, the most beautiful part of yoga is that it's about me looking at me, not looking at everybody else who has a rotator cuff and how are they going to respond, and you know what I mean. But it's about me. How am I responding to this scenario? Have I tended to respond in the past? What are my behaviors? What are my beliefs? What are my reactions? And what else in my life is changing? Does
So
that
it gives you this sort of contemplative space to see yourself as something more than someone with pain or injury or whatever the thing is. And it gives you room to investigate what else is going on, or what else could I act on? Maybe there's nothing I can do about my shoulder, or maybe I'm already working on that with a physical therapist or with a surgeon, but what else is going on? I'm not just a shoulder, I'm all of the rest of me too.
exactly? And
Mm,
all of the rest of me doesn't fully change when I'm in pain. Right. And I think that's a big part that I feel like as yoga professionals, we have the ability to engage with people who are suffering. And especially if there's somebody who's coming to a yoga teacher for assistance, then they're kind of already open for that. They want to hear an alternative approach, rather than medications and surgeries.
mm,
And so I think, yeah, kind of saying, okay, but so my shoulder hurts, but what else is there?
mm.
Right? Like, I mean, I can give you an example of a patient who came in with a long standing history of back pain. And, he had been a professional weightlifter. And, it's so much of his identity was wrapped around going to the gym and being able to weight train. And, he comes in, he's like, well, I can't do it anymore. I haven't been to the gym in 2 years. And my immediate insight is like, but why? Like, there's so many things that you can still go and do.
Mm,
And if that's the place that makes you feel the most like you, then go.
mm,
It's shifting the, like, you can't compare yourself, or it's dangerous to compare yourself to what you used to be able to do. But let's talk about what you can do. So,
mm.
same thing, like if somebody comes to you on their yoga mat and is like, well, I just can't practice yoga anymore because my shoulder hurts and I'm here because I want you to fix my shoulder. Then, I mean, I think I would say, all right, so the very first thing is to look at what we can do,
Mm.
right? Like, let's get you back on your mat again, even if it's just sitting and breathing and doing some very gentle supine openers and connecting to your body, and then starting to see, like, oh, wow, there's a lot more ability here than
Mhm.
what I
And I've
actually.
experienced that completely. We say just sitting and breathing, but my goodness, those things can be extraordinarily powerful. I had a client that really shifted my thinking about pain enormously, where she had some undiagnosed issue going on in her neck, extreme pain. She wasn't seeing me to fix it. I certainly wasn't promising to fix it. She was seeing a doctor for that. But she said she really missed practicing yoga and she wanted to come and practice yoga with me. And when she came, she was in so much pain, she was crying. And my initial thought was, there's nothing I can do safely with this, sweet lady in her 70s who's in so much neck pain that she's crying. But I said, what do you miss from yoga practice? What do you miss the most? And she said, oh, the breathing. And I was like, well, great, that we can do. We can breathe. Where do you feel the safest? Where are you the most comfortable? Great, let's set you up in that position. Let's breathe. And it took maybe 45 minutes for her head and her neck and her chest and her shoulders to relax. But after 45 minutes, she left saying that her pain had reduced by half. And I
Mm.
still had no idea what was going on in her neck and had done nothing to do with her neck at all. But the power of feeling safe, relaxing, breathing, returning to something that she had missed that for some reason she had told herself she couldn't do, changed her experience of pain completely. And that was, to me, the floodgates were wide open, and I was curious about everything that pain science had to teach me, because it was just sitting and breathing.
Yeah. Yeah. And that's beautiful. I mean, you did some amazing things there. And I think the first thing was asking her.
Yeah.
So many people who have been in this place of suffering feel like they haven't been heard, they haven't been listened to, they're not getting help. They've heard from professionals and family members how awful everything is, and they feel very hopeless.
Mm.
And I think giving them a little bit of a voice to say, "I'm hurting. Okay, what is it that you want to do?" And some of them come out with these beautiful answers, like you got, which was breath. I mean, she gave you the answer. Others, you might have to pull into something. I want to be able to stand on my hands again. Okay, let's start with legs up the wall.
Yeah.
you know and I think, I use the word just, but it is important to recognize that sometimes we throw those little language pieces in. And I know I'm jumping back to that, but we can pull it back around too. But
Totally.
saying, well, just breathing does diminish it, and it's not like there's nothing diminishing there, right? Let's breathe. That's
Especially
so
once we
important.
understand that pain has this really enmeshed relationship with our physiological stress response. If we can work on
Right.
the stress response, we can work on pain. And quickest way to work on the stress response is breathing. So
Right.
it's a big lever to pull on.
Exactly. I mean, the breath is one of the only um, entities in our body that is controlled both um, consciously and not, right? Like, we're going to breathe whether we're thinking about it or not. And it has a direct link to our stress responses. So if we can regulate our breath and find some soothing and comfort there, then we can regulate our heart rate, and we can regulate, a lot of the other hormonal things that are associated with stress and the internal responses around it.
Yeah.
So yes, it is huge. And it's a
And
great
simple
place
movement
to
too.
start.
Yeah. I
Yeah.
think you spoke about asking questions, and I think that's a really nice thing that for me comes with being a yoga teacher, that I'm not a medical professional. They know I'm not supposed to have the answers, and I'm not going to be able to diagnose or treat. And to me, that's great, because it really creates space for me to say, what do you need? How are you feeling? And if they don't know, because, sometimes people don't know, I'll say, well, let's start here. We'll do this thing. And afterwards, you tell me whether that was closer to what you needed or further away. And so we'll kind of fine tune our direction from there. And to me, not being the expert in their pain sets us up for a completely different relationship to perhaps what they've had with their medical professionals, where they start to take control right from the beginning. That was great, but I feel like I need to move a little bit. Perfect. Let's move a little bit. Or that was great, but the movement triggered some anxiety around my pain. I think I need to be more still. Great. Let's get you comfortable enough to be still.
Right. And I think it's the connecting of all of those pieces, right? So if somebody can have some movement and recognize, wow, I'm feeling anxious. Okay, does that mean that we stop moving? Or
Maybe,
does that,
maybe not.
maybe, right, maybe, but maybe it might open a space of like, can we find some movement that just like leans into that feeling of anxiety and allows you the opportunity? I mean, we can come back to that practice of the darts, right? So is the movement truly the first dart that's creating the anxiety, or is it fear? Is it fear that this movement is harmful for you? Is it that we've kind of started to partner these things? It's like we've created these maladaptive movement patterns to protect us, and we're learning to avoid. And if we start to go into that, then we feel anxious because really in this new world of our painful experience, that's a foreign movement, and we've been told not to do that.
And
Right?
sometimes we can see that more easily from the outside than they can feel from the inside, because it's such programming. So maybe you do
Yeah.
start to move, and you see a bit of tension around the neck or the shoulders or the face, then as somebody working with somebody in pain, you can say, hey, you're frowning a little bit. Is that uncomfortable for you? And getting them to check, is that actually uncomfortable for me? Or am I just nervous that the discomfort is coming? So having them, rather than just blocking out that monolithic experience, maybe move towards it a little bit and get a little bit more curious and go, what am I actually feeling? Is that the pain, or is that just the anticipation of the pain? How far can I go before the pain does come?
Right. And I think just opening that conversation is so helpful. Tell me what you are feeling here. I mean, and that language that we use with each other, and that language we use in our head, and how we describe what we're feeling, it really it'll leave a physical impact on us. I mean, I can't tell you how many people I've seen who, like, for example, I had a woman recently with a shoulder pain, and as a PT, one of the first things that we do is test range of motion. And she says, I can't move my shoulder at all. I can't move it at all. And immediately I could be like, well, she's lying. Or I can go, actually, that's what it feels like to her, is that she can't move it at all. And so just shifting it of like, I can't move it without feeling, right? Okay. But you can actually move it. So our game, we don't need to work on range of motion here. We need to work on feeling safe and secure, and recognizing that this pain could also just be a sensation. Like, tell me what you're really feeling there. Is it stiffness? Is it apprehension? Is it anxiety? Is it sharp and stabbing? Do we need to, so teasing out all of those things and asking them to look at it rather than kind of giving them words, I think is really important. And connecting movement with breath to help soften those secondary reactions is really powerful.
I noticed that people that I work with who've been in a pattern for a long period of time, whether that's pain or fatigue or whatever it is, they do seem to have a decreased ability to find words for that experience, or to really look at it in detail, which kind of makes sense, doesn't it? If you've been trying to block out pain or discomfort for a long period of time from this part of your body or this particular movement or position, it would make sense that you'd get a little bit less nervous system information from that body part or that body position. So what advice would you give to people who are either in that experience themselves or working with somebody who is, where you don't know exactly what you're feeling or where you're feeling, and you find it difficult to find really clear descriptive words for it? Where do you start?
Yeah. If I give you just the tiniest bit of the kind of the neuroscience behind that, we do actually, we use the word maps. It's kind of a controversial term, but I still think it's an easy description of, we have sort of this map in our brains of how our body lives and moves, and they do actually change. So the way that things are represented in our motor and sensory cortexes shift a little bit when we've been in this long place of protection. And when I say long, it doesn't actually have to be that long. There's some studies that, take like 2 fingers, and right now my 2 fingers are represented too. If I tape them together, it's like within 20 to 30 minutes, my brain now has shifted and makes these do this. So just for a moment, put that into somebody who did potentially have a rotator cuff, say surgical repair. For 6 weeks, they're like this. So are we like trying to gain all the range of motion back from the things that happened to their shoulder? Yes. But are we also trying to, shift and reprint the map in their brain that this is a safe place for that shoulder to live? And I only throw that out there because it's an element that I think, as somebody from the outside, it's important to recognize that there's so many little layers to this whole pain experience. And you don't have to understand all of them down to the deepest, neuron, but understanding that they are there, I think, is important. And so, how do we get in with that with somebody who's kind of saying like, I don't know how to describe it. It feels foreign. I mean, a lot of people even will tell me like, I can't really feel it that well. Like
Mm.
this doesn't feel like it's mine anymore.
Yeah, I
And
even
so,
had somebody, a yoga teacher, actually say to me, "This shoulder, I just want to cut this thing off." And I thought,
yeah,
"Oh, what violent language against your own poor little body that's only trying to help."
right. Right. And so, I'll use body scanning, just a
Mm,
really typical, meditative yoga practice of body scanning. First, just noticing and naming everything, as it's there, and then really noticing, okay, so this feels bigger and more present, or this feels like fuzzy and vague. And if this
mm,
is big, can I feel what it would feel like to bring it down a little bit? And, it's a lot of imagination and just sort of self talk and visualization. And if this feels vague, like, can I touch it? Can I bring it in a different way? Can I move it in different directions? Can I just offer a lot of breath there? Can I paint it? I mean, I use all kinds of different ways for people to kind of bring those places into their imagery more. And I don't always ask for them to communicate. If they say, I just can't really, it just feels vague and foreign, and I don't have words for it. Okay, you don't have to have words for it. Just
mm,
let's keep your attention there and tell me what else happens to be present.
mm,
Is there a temperature difference? Is it warm? Is it cold? Does it feel like there's water flowing over it? Things like that can help to just, help to bring it in. And I think it is really important to point out there that that's a violent language of, like, saying, I'm just going to cut off that. I just want to cut off that arm. Like, yeah. Oh, you want to give that some loving kindness.
yeah. And I think that's what's lovely about thinking of it as pain care, not
Yeah.
pain, elimination, but pain care. Pain is a signal that the body's giving us for a reason. It's not doing it to piss us off. It's not doing it to let us down or to destroy our options in life. It's there for a reason, and it's our job, I guess, to care for it and to investigate and see what we can find out to maybe create a space where it doesn't have to give that signal anymore, or maybe just to interpret the signal in a different way.
Yeah, exactly. I One of the other kind of mindfulness practices or Buddhist principles that we bring into the book is and this too.
Mm,
And I think that's a beautiful way to pull that in, of that including, like, what happens if I it's not just about accepting that, I have this painful shoulder and that's what it is, but it's about actually including, right? So I have a painful shoulder and it's part of my life,
mm,
and I'm going to care for it as if I had a tender, emotional heart space. Or, like, if I had a child that was, tender and sensitive, I'm not going to just be like, gosh, I want that to just go away,
hmm
right? I'm going to pull them in and hold them a little closer and treat them with a little more kindness and
mm,
understanding. And if I can think about my body like that, that's kind of a beautiful thing, right? So it's like, okay, I am a yoga teacher and a physical therapist, and I have a sore shoulder that's, it's sensitive and it's tender right now. And how long is it going to be that way? I don't know.
mm,
What am I going to get to learn out of this scenario? I don't know yet, but I know there's going to be a lot of things there if I
mm.
listen. Yeah.
Open up the lines of communication.
Yeah.
Mm.
Yeah.
So you've
Yeah.
talked
And
about quite a few yoga techniques already, the body scan, breath awareness. Uh, and I also use myofascial release for that similar thing of what exactly am I feeling here? Does the sensation change when I move from this spot to this spot? I always start by telling people you don't need to go anywhere that's painful, but I do want you to kind of look around the edges. And often when they look around the edges, they can get a lot closer to the spot that they thought was painful. And sometimes they get there and there's not actually any real pain at all. But let's talk about some specific yoga techniques that you found helpful working with people in persistent pain.
yeah, I mean, it's such a broad thing, but definitely the pranayama. I mean, that's one of the things that I almost always bring in, and usually pretty early on.
Mm,
And I tend to just use a very simple first, just monitoring.
Mm-hmm.
And sometimes I'll combine it with the body scan. So in that scenario, the cues are, we're just sort of letting your mind's eye travel gently, through your body while you're monitoring what your breath is doing. So, as you come into that area, let's say, that it's my knee is my left, as my mind's starting to travel towards my left knee, does something change with my breath? And if it does, can I practice that softening or shifting that response? Right? Because if I'm just laying there and all I'm doing is scanning and I can sense, wow, I like get to this area that I've had all these strong sensations from, and I start to splint my breath, make things more shallow. Um, then what happens when I'm actually trying to move that area?
Mm.
Right? So if I can soften those responses in a really controlled, simple environment, it's an easy place to start.
Mm.
And then combining that with some movement. And sometimes, it's movement. So if it's my lower half, it's my persistent pain struggle, then I'll start with just learning how to move and float the upper half,
Mm.
and then bring that down into the lower half and see how it goes to move with the breath, and really like keeping that awareness to the breath rather than to the movement. So it doesn't really matter what my body's doing.
Mm.
And that maybe is a little bit of a shift from some, if you're a real, I guess, traditional asana teacher, you know, being able to be very creative and curious in how you're now asking for those postures and movement to be performed, but allowing them to be a way for the person to just find a lot of curiosity in
Mm.
themselves. So, what happens if I turn my toes in or my toes out, or let my legs go limp or let them go strong? Um, so, I mean, I do use asana or movement, and in my head, I think of it as very mindful movement, and that's the difference between, just an exercise or a typical PT program, is that I'm asking them to put their head and their breath into the
And that's
exercise or
difficult to
activity.
research. That's where we kind of come up with challenges with researching yoga
Exactly.
and pain, because it's a tough thing to pass out and research whether you're intentional about it or whether you're just doing the movement. I I love
Exactly.
I love where you were heading there, though, that there's always something that you can do, and it doesn't have to be the complete picture of the pose that we might see in a textbook. Maybe it's just the head and neck, maybe it's just the arms, maybe it's just the upper body, or maybe we're taking the lower body and playing with traditional alignment around the feet or the knees or the hips, or keep going.
Yeah. So, pranayama asana is for sure the mindful movement, and really kind of changing the expectation of why you're moving. You're right now, you're not moving because we're trying to correct something,
Mm.
because nothing in you is broken, you know, but we're trying to learn, right? It
Mm.
comes back to that, like we're yoking all of this together. We're trying to learn, how is it that I have shifted my movement? What feels free? What doesn't feel free? And what changes are also there? Am I splinting my breath, my heart? So kind of starting to wrap in some of those other little awareness pieces.
Mm.
Um, I think, you can play with the actual 8 limbs a bit, and like, am I being truthful?
Mm.
Am I truly, am I being truthful? That comes back to this, like, I can't do this at all. Okay, wait, but look at that. I can. So what's real here, you
Mm.
know, and what's not totally true.
Mm. You
So,
use that
kind of,
phrase "real but not true" quite a bit to,
yeah,
and it's so right, isn't it? What you're experiencing is not imagined. It's not made
no.
up. It's absolutely real, but there's more to it than that. Let's investigate.
Exactly. Yeah.
Mm.
And I think that's a great word, like investigate, but also not like, I'm not investigating it like I have to get to the bottom of this,
Mm.
but I'm just like, what's here?
Mm.
What is this? What else is here?
Mm.
Wow. Okay, so what's here is that I do actually have full range of motion, or nearly full range of motion.
Mm.
And then I have this, like, oh, this strange thing that happens when I do that. And, my my breath goes and my heart rate goes, and I have memories of how much that hurt. But now it's just kind of sore.
Mm.
So again, like teasing things out, untangling things. I work with that a lot with people.
Mm.
I tend to dive into kind of the I was going to say it, but I'm going to shift the way that I even speak about it. But looking at where we are right now in this moment.
Mm.
So I was going to say, like, trying to avoid the future thought, because that's where we can get really going down that rabbit hole of catastrophic thoughts of like,
Mm.
but I have to be able to do, this because I can't be this way forever.
Mm.
Okay. But where are we right now? Right. Like if I go back to the guy who wants to go to the gym and weight lift, but I can't, bench press 550 pounds. Okay. You can't today,
Mm.
but what can you do?
Yeah. And
So
you also
again,
couldn't
like,
bench press 550 pounds the first time you went to the gym. So maybe there's a
exactly.
journey involved. Yeah.
Exactly. So I think that, like, trying to be in the moment. I talk a little bit about, sort of that dualistic or comparative thinking.
Mm.
If we get stuck in the comparing to other people's experiences, my best friend went through this rotator cuff surgery, a year before I did, and she's totally fine and I'm not. Why is that? Like, well, because that's not your body. So looking at that, what I used to do, kind of coming out of that place of the past, I play around with that. Other specific yoga things.
Do you
That's
talk
a
about
lot of
yoga
it.
philosophy with people who seem interested or feel open to it? Ahimsa and Satya and Svadhyaya. Yeah.
Uh-huh. Yeah. And sometimes I feel like when for some people, using those, more Sanskrit or traditional terms gives them something kind of um, beautiful to hold on to.
Mm.
And that feels like it's rooted in this traditional practice. And I'm going to look at it from my pain experience, but I'm also going to look at it from this holistic journey that I'm on. And for some people, that's easier than
Mm.
going kind of more of the blunt approach of like, you're not actually being honest with yourself. You know what I
And I
mean?
guess it
So
reminds them that people have been wrestling with issues like these for thousands of years. The ancient yogis
exactly.
were not immune to the stories that the brain would tell itself. And this is something that they developed that worked for people for generations. Maybe it's worth us investigating now in the context of what you're experiencing.
Exactly. And that
Mm.
idea that we're not alone.
Mm.
I think I listened to a podcast one time with Brene Brown and Oprah Winfrey, and there was a comment about like there's not a single human emotion that somebody else hasn't already experienced.
Mm.
And that was really meaningful for me in that moment. And I feel like I have used that with my patients too. Like, you know, this sensation that you're feeling, this, loss of movement that you're feeling, this shift in your perception of things, this heightened stress response, this whole mandala picture is uniquely yours.
But
But and you're not alone.
mm.
You're not alone. Other people's mandalas look different, but they're all still, made up of the same parts, just put together differently and playing out differently.
And I think
And
pain can feel isolating, kind of. It can make us feel like we're all alone in this. And I think that's where it can be nice to feel like you've got someone along with you for the ride. Even if I'm not experiencing pain at the same time, at least I'm there with you and I'm asking you, how does that feel? What is going on for you? What is helping? Is that better? Is that worse? Just something about having company makes it feel a little bit less scary, perhaps.
absolutely. And again, like we said earlier, and you just did again there really nice, which is like asking those questions
Mm.
and really being there with them, holding the space with them in a way to just guide them to find their own little way out rather than, again, if we talk about like the language we choose of like, well, if you do this posture, then you will feel this.
Mm.
You know, I mean, how many times have we been in a yoga class that it's like, and now you feel blah, blah, blah.
Yeah, and I mean, maybe there was a point in my practice where I believed those things, but I think I'd been practicing for such a long time by myself before I did any formal training that there was a lot of space for me to be like, well, that's not what I feel when I'm in that pose, but I feel that when I'm in this pose. So maybe that set me up in a really good place to be a bit more open-minded because, you know, people are surprising. People are different.
Surprising. Yeah, everybody, we're all different.
Mm.
And that's fine and great.
And fun.
And exactly, it's really fun. And in some ways it gives us a lot of freedom, right? Because there isn't really a right and wrong way to approach someone who comes to you for pain care.
Mm.
Right. So, and
Right.
I think that's an important thing to remember, that if I happen to say to them, you know, if you get into this place, you're going to feel this. And if they don't feel it, somebody who has a kind of healthy coping strategy, you know, optimistic outlook on life is just going to be like, well, that's okay. I don't feel it there. You might, but I don't.
Yeah.
Others,
Mm-hmm.
and then when you're in that place of like feeling like there's something already broken inside of you, then you feel even worse, or you have the potential of feeling even worse, right? Like, oh, I should feel it there. I don't. Oh, I must be doing it wrong, or there must be something wrong with my body, you know. And so really allowing an individual to have their own experience and asking them, what do you feel? Where do you feel it? You know, and okay, well, if we shift this, does that shift that? And what happens if you do this? Oh, well, look at that, you know.
Mm.
So just
Yeah.
allowing people to be very playful and curious in their movements, I think, is really important.
And it's funny how powerful that makes people, how it reminds people that they have the capacity to choose and decide. They can take in the information and act accordingly. I kind of think of curiosity and playfulness as being really sort of soft, stretchy, malleable things, but there's a real power in that because I guess you're trusting that I can be curious and then I can go, less of that, more of this. It really puts the person in persistent pain in charge of their experience. And I feel like there's maybe nothing more therapeutic than having people feel some sense of control.
Yeah, absolutely. And I think that's where, I mean, I think that's where this mandala picture can come in so nice, because if you only look at like, if somebody comes into you and says, you know, make this pain go away, you both might feel pretty helpless and hopeless there.
Mm-hmm.
But if you can step back and be like, okay, what else is feeding this whole painful experience? What can we immediately feel like we can control or shift or put some attention to? And what's going to change from there? You know what I mean? So it just opens this whole avenue. And you're absolutely right. I mean, control and hopefulness, you know, are incredibly empowering for people.
And I think you're right. It goes back to what you said earlier, that it means there's really no wrong place to start. You start somewhere. It turns out not to be as influential as you hoped. That's okay. We'll try plan B. And maybe that gets you closer to what you were looking for. Maybe it doesn't, and you go for plan C. And each time you're learning something along the way, less of that, less of that. Oh, but more of this. This was really helpful. So it kind of takes the pressure off you to think, I've got to find the right solution for this person in this scenario. And if I find the wrong one, we're all in big trouble. It just creates space for everybody to explore and experiment and then shape behavior based on what happens.
Exactly. Yeah. Very well said.
So we're kind of working our way through the 8 limbs of yoga. We didn't get to meditation, but I'm sure that's helpful for some people in some scenarios as well.
Yeah. And, you know, I think that's where I actually, with all those little mindfulness tools that we were talking about, to me, you know, and this is something that when I was in the book writing process with my co-author, Neve, she, you know, she was challenging me with the terminology, right? Of like, well, what's meditation and what's mindfulness and what's blah, blah, blah. And, you know, in the end, I sort of brought it down to like, to me, meditation is the active practice of being mindful.
Paying attention on purpose,
paying attention
without judgment.
On purpose. Exactly. And we carve a specific time for that, right? So I'm going to assume a posture of relaxed and alertness. And it might look like what we're taught, and it might look very different because when we're in pain, we might not want to sit like that. But what we're doing is we're paying attention, right? And we're paying attention maybe for a select amount of time to something specific. It could be our breath. It could be a point on the wall. It could be a part of our body, and so that to me is all part of meditation. And then the idea of mindfulness is, can I take what I've been practicing and put it more into the moment? So can I take this meditative practice and put it into my asana practice, right? Can I move with the same focus point that I started with when I was not moving, whether that's my breath, or this just curiosity or inclusion of sensations, or working at paying attention to how often I name sensations with a negative connotation rather than a like, oh, this is just what that is, right? And then can I take that out into the other aspects of my life, right? So can I walk down the stairs and feel that same sense of curiosity and freedom and acknowledgement of when I'm guarding and when I'm not guarding, and when I need to and when I don't need to, so that to me is the like mindfulness, is being in that moment and putting that focus point in the moment. And meditation is when I'm actually specifically sitting down, standing, laying down, whatever, but I am practicing what I want to be the most mindful of. Does that make sense?
Absolutely. You're practicing
So
it
I use a
formally in
lot
the
of
hope that it
meditation.
becomes more
Exactly.
natural. So we've mentioned sort of tangentially quite a few times the importance of language, whether that's the language that we use when we're talking to people with persistent pain, or whether it's the language that we use in our own minds when we're experiencing pain. Maybe that's a good place to wrap up by having you talk a little bit about nociceptive language or more inclusive language, or how we can sort of set ourselves up for that open-minded curiosity as opposed to imposing rules from the outside.
Yeah. I just can't tell you how important it is. And it's a great place to wrap up, because it kind of brings us full circle to the conversation we started with, which was when I first started learning about pain science and trying to shift how I was working with individuals in pain. It's the first thing that I cued in on that made a huge difference for them and for me trying to help them, which was just to, look at how often we use these really powerful words that make us feel broken and incurable. Even the term chronic pain versus persistent pain, when we think of something that's chronic, we think of something that's not going away. And if we think of something that's persistent, it's there, it persists in our life for the length of time that it does, but it doesn't necessarily mean it's going to be there forever. And so that's a simple thing of, and I am maybe too well known in my practice and friend circle of, challenging those little thought processes. Like, a great example was I was on the phone with my mom this week. My dad's having some back issues, and my mom's response is, "Thank you for helping him through this crisis." I'm like, well, we're not in a crisis. We're not in a crisis at all. Dad's having some back pain, and we're going to work through it, and it's going to be okay. And so, I think as we talk to people, recognizing the language that we use, oh, that's so awful. I'm so sorry. Oh, I'm sorry that you're struggling right now. Just those little simple shifts, right? And how we talk to ourselves, how we look at things in ourselves, I think can be a good in, because we can notice how we've been trained. And then you can hear from the individual, I was told that, I have a back worse than a 70-year-old, or my, my MRI is terrible. And but so can we just find little ins? I'm kind of stumbling around here, but can we find little ins to shift those actual words? And when we're teaching, it's another really good place of, rather than saying don't do this or make sure you do that,
This will
I
protect.
exactly right. I invite you to try this, or what does it feel like when you do that? What are your sensations? So really, again, asking the individual what they're feeling, and for them to be curious and to look at it just in that way of like, this is a place to learn, and what we feel is what we feel, and it might not be bad and it might not be good. It just might be what
Yeah.
we feel.
And even when we're in a group scenario where we're not able to ask individual questions, we can be more aware of our languaging. So even if I'm teaching a pose like pigeon, which is notorious for hurting people's knees, or at least for creating pain in people's knees, I might say, now, if you're feeling sensation in your knee joint instead of your hip, what I'm targeting are the muscles around the hip. So here are some options that take some of the body weight off your knee, or that allow you to focus on the hip instead. And that was prompted by me having a conversation with a girl after pigeon, where I said, you looked a little bit uncomfortable. What was going on there? And she said, oh, my knee was hurting, but I don't have bad knees. And I was like, why would you need to have bad knees in order for that cue to be helpful for you to move away from pain in your knee? We're not even focusing on the knee in this pose. I'm hoping for you to feel something in the muscles that wrap around the outside of the hip. So just bad knee, bad back, and shifting it to sensation perhaps, or where your targeted tissues are as opposed to where they might be feeling it. Just create space for everyone to take the actions that they need to take without there being a label associated with it. Oh, I must have bad knees. Oh, I must have a bad back. Oh, I need to protect my bad back.
Yeah. I mean, the bad and the good side is is one, again, like that's one of the first things that's easy to notice, just changing that to, this might be my weaker side, my stiffer side, my side that needs a little more special attention.
Yeah, the attention. I really like that one. No, this is the leg that needs a little more of our attention, but it's not your bad leg, and it's not even really your weak leg. It's just not as good at the thing we're asking it to do right now, so we're going to give it some practice.
Exactly. And I think that's a great thing. I think really inviting people to not follow specific cues in class sometimes of like, what does it feel like if you shift that? Instead of saying, like, we'll use pigeon, instead of saying look back and straighten your back leg or push down to your toes, what's your back leg doing? Do you know? What does it feel like to you? Can you straighten your knee a little bit more? And does that change where your sensation is? Little things like that. And I'm just going to say it because I picked up on it. And again, it's something that we're just so programmed with. Is the like, pigeon causes pain in our knee.
No, it's just one of those notorious places where people feel knee pain. Does it cause it? Probably not. But it's just one of those places that I always think of as, for the people that I teach, many of whom are either pre-knee replacement or post-knee replacement, it's something that I think about there, of being aware of letting them know you don't need to feel discomfort in your knee here. But how to say that without creating that feeling of, oh, I must have bad knees? Yeah, it requires some real nuance, doesn't it?
It does. And I think just being aware of how often we say things like that, like this pose might cause pain in your knee, or this might be bad for your knee, or this, maybe you should avoid this. If you've had a total hip replacement, you should always avoid that. Yeah. And the truth is, there's certain time frames, and yes, you have to avoid things, but after a certain amount of time, most of the time, our body should be free to return.
Yeah.
And so again, just really, like, initially, I would say as a teacher, just start listening to yourself and how programmed we are with those things, and where can we as individuals slowly start to shift to soften our own language, and then you'll start picking it up from others a fair bit too. And
something
I think
that I find helpful is carry on.
I was just going to say, changing. I think that one of the easiest things first is changing that word pain to discomfort, or sensation, and recognizing that okay, I can actually be a little uncomfortable, and that doesn't have to be a bad thing. If I initially say, oh, that's a painful position, then I'm going to be like, I don't want to be there.
Mm.
But maybe it's just a little uncomfortable. And if I soften this and shift that, then I can stay a little longer and then I have a little better benefit.
And it's a delicate balance to give people space to investigate and then to take action should they need to. And something that I find helpful is not making it a permanent thing, but today, if your wrists aren't happy bearing your weight today, you can be on fists or fingertips, so that it's not an assumption that this is what your wrists will need to do forever. But today that doesn't feel right, because that's certainly my experience in my body of today my ankle doesn't like that, or today my wrist doesn't like that. But tomorrow is a different day and it'll probably be different tomorrow.
Exactly. And even, even beyond the today, it could be at this
Yeah,
moment.
right
Like maybe
now.
I just need to do a little bit more to create some, release or movement. And so I think just acknowledging like, ooh, right now that doesn't feel that great. But if I can try something else first, and then if I go back to it and it still doesn't feel that good, then maybe I don't do it today.
Mm,
But I think those are great things to look at your own body and in your own practice.
mm,
And then once you can notice that, just because somebody's in pain doesn't mean that they're any different in that scenario,
mhm.
right? So ask them to have those same kind of explorations. Okay, today, how does it feel? This moment, how does it feel? This movement, how does it feel?
Mm,
And not like, are you in pain or how is your pain? But how does it feel? What are you
yeah.
feeling right now? And oftentimes, when people are asked that, how are you feeling right now? They don't actually say painful terms.
It's true. What
Right? A lot of
sensations?
times sensations
Mm,
or apprehension or
mm,
I'm afraid or I notice this anxiety or wow, I notice this tension, I have this like kind of numb, tingly, vague feeling. And that I think when you're the one providing the pain care, when you hear from them what it is that they really are feeling, it will soften your protection of them as well.
yeah. Absolutely. And I think that's important too, going back to the person feeling empowered, is it, it's not incumbent on you to protect them. It's incumbent on you to create space for them to explore and experience and then sort of ascertain helpful right now, not helpful right now, interesting right now, not interesting right now. And it really does take the pressure off you and let you take a step back just to give them space for that exploration.
Exactly.
Mm.
Yeah. Yeah.
Or maybe that's a natural, I won't say stopping point, because we could probably talk about pain, persistent pain in particular, all day, but you probably have places to go. So you have this fantastic book, which I can't recommend highly enough, that you co-authored with Nev Maloney, Pain Science, Yoga Life. And it's got really something for everyone. There's some good nerdy science in there. There's a bunch of references for the people who really like to dive in with their brain, but there are also some great practical examples if you feel like you need to understand what that means in daily life. There are case studies to see how that might reflect in other people. And there are practices too for you to dive into, even if you're somebody who's never experienced persistent pain, to find your in to getting a window on that experience. So for people who are interested, there's a website, painscienceyogalife.com. You can buy the book from Handspring Publishing. And Marnie, you've also done a course on yoga medicine called Pain Science for Yoga Teachers that is a fantastic introduction to having us challenge some of our misunderstandings about pain and to think about the way that we work with people in pain, our languaging, for example. You've also got some classes on yoga medicine online and a monthly dose lecture to get people sort of intrigued in pain and pain science. So that's a lot of places for people to dive in a bit deeper. Where else would you send people who want to know more about you and what you do?
Oh, I will admit that I'm in a little bit of a shift as far as being have a strong presence virtually, but people can email me if they want to. It's just bodyiqpt@gmail.com. And I'm sure that can be a link that's put up that if people want to go to that, I'm happy to, offer some consultations or listen to stories or give some reflections as needed. And I do. It's been so great to come into pain science, or come into yoga medicine, and bring some of the things that I've done with Pain Science Yoga Life, and offer it out there, because I just believe it's something that we can all help others with.
Oh, absolutely. And I think the thing is that pain is such an individual experience. The methods that we should use to work with it, I think, are also really different too. So it would be lovely to have a 5-step plan to work with people in pain. But the reality is, we look at that mandala and we start somewhere and we see where it goes. There's not really any right place to start, which means there's not really any wrong place to start either. Just get curious.
Exactly.
I've really enjoyed our conversations today, and I'm sure there are lots of nuggets in there for people to take away. So thank you so much for sharing your time and your expertise with us.
Thank you for having me.
Thanks for listening to Yoga Medicine. If you liked the show, be sure to subscribe and leave a rating and review on Apple Podcasts or wherever you listen to podcasts. And if you got something out of this episode, please spread the word and share it with a friend. You can find more information, articles, trainings, and classes at yogamedicine.com. Check us out on social media as Yoga Medicine, or you can email us at info@yogamedicine.com. Thank you for being part of our Yoga Medicine community.
The content of this podcast is not medical advice and is not meant to replace medical care. Please consult your healthcare provider to determine what is best for your unique healthcare needs.